All right, today we're diving deep into a dental procedure that's really a tale of two very different teeth. We're talking about the pulpotomy. You might have heard the name, but we're about to get to the heart of why it's done and what makes it such a fascinating and specific treatment.
So, has a dentist ever thrown around the term baby root canal? Yeah, chances are, if they have, they were actually talking about a pulpotomy. It's a really common nickname, but you know what? As we're about to see, it doesn't even begin to capture the whole story.
So what is it officially? Well, a pulpotomy is the surgical removal of just the top part of a living tooth's nerve, or pulp. I like to think of it like this. If you have a plant, and one leaf on top gets sick, you don't just rip the whole plant out of the ground, right? No, you carefully prune away that one sick part to save the healthy, vital roots underneath. And that, in a nutshell, is a pulpotomy.
Okay, so when does a dentist actually say, yep, this calls for a pulpotomy? It's definitely not for just any old cavity. This procedure is reserved for very specific situations where decay has gone deep, and I mean deep, threatening the nerve. But, and this is crucial, it hasn't compromised the entire tooth just yet. Let's take a look.
The most common reason by far is for a baby tooth with a deep cavity, where that nerve is exposed but still alive and otherwise healthy. But when we start talking about permanent teeth, its role kind of shifts. It can be an emergency fix to relieve some really severe pain until a full root canal can be done. Or, and this is super cool, in a young, still developing permanent tooth, it acts like a temporary shield, buying precious time for the roots to finish growing strong.
So how does this whole thing actually go down? I mean, what does a dentist do? Well, it is a very precise surgical procedure. We can break it down into three basic fundamental steps. First, the dentist carefully removes only the inflamed nerve tissue from the crown of the tooth. That's the part you see when you smile. Next, and this is a really important diagnostic step, they control the bleeding. If it stops easily, that is a fantastic sign that the nerve down in the root is still healthy. Finally, they place a medicated material over that healthy pulp to protect it and let it heal.
You know that step about controlling the bleeding? It's more than just being neat and tidy. It's a critical test. See, if the bleeding doesn't stop quickly, that's a big red flag. It tells the dentist that the inflammation might go deeper than just the crown. For a baby tooth, this might mean hitting pause on the procedure and scheduling a second visit. It's like a built-in safety check to make sure they're getting the best possible outcome.
And this brings us to the absolute central idea of this whole explainer. The one thing that changes everything about a pulpotomy. Is it being done on a baby tooth or a permanent one? Because the answer completely redefines the entire goal of the procedure.
Okay, here is the key difference, the most important takeaway. For a primary or baby tooth, a pulpotomy is the final treatment. The goal is to save that little tooth and keep it healthy until it falls out on its own, acting as the perfect guide for the adult tooth coming in. But for a permanent tooth, it's almost always just a temporary bridge. It's a strategic move to buy time, either for pain relief or to let a young root mature before a full root canal is eventually performed. This distinction, it's everything.
But you know, because those goals are so specific, especially when we're talking about baby teeth, a pulpotomy isn't always the right move. It has its limits, and dentists really have to look at the fine print before they proceed. The dentist has to make a really careful judgment call, and their number one priority isn't just saving the baby tooth, it's protecting the permanent tooth that's developing right underneath it. That future tooth is the real VIP in the situation.
So a dentist will say no way to a pulpotomy if the baby tooth's roots are already dissolving naturally, or if it's breaking down from the inside, or if there's a serious infection. The reason is really simple. Any one of these issues could spell trouble for the permanent tooth below, and protecting that future smile is always the top priority. This brings us to a really key quote. A pulpotomy is regarded as a temporary treatment. Now that we have all the context, it makes perfect sense, right? This is talking specifically about permanent teeth. It just reinforces that idea that it's a crucial step, but it's not the final destination.
And here's exactly why it's considered temporary for adult teeth. Over time, that treated tooth can develop issues, like the canal calcifying and blocking up, or the rest of the nerve tissue just dying off. These potential complications are why a pulpotomy on a permanent tooth is usually just paving the way for a more definitive treatment, like that full root canal down the road.
So, let's circle back to our big question. Is a pulpotomy a tooth-saving procedure or just a temporary patch? Well, the fascinating answer is, it's both. For a baby tooth, it's a definitive long-term solution. For a permanent tooth, it's a vital temporary fix. The purpose is defined entirely by the context, which makes it one of the most versatile and clever tools in all of dentistry.
Thanks for joining me on this one.